Here from Vet Triage. We are going through this issue of JAVMA from February 2015. We're going to be talking about ferrets, the constant rate infusion of glucagon as an emergency treatment for hypoglycemia in a domestic ferret. This study comes out of the vet school in Saskatoon, Canada. So this is a 3-year-old female domestic ferret with an insulinoma that was treated because of a hypoglycemic crisis prior to a pancreatectomy. They had an abdominal ultrasound done before surgery that identified a 1 by 0.5 centimeter hypoechoic nodule in the pancreas. The same glucometer was used throughout the duration of this case. The clinical signs also included lethargy, hind limb weakness. They tried doing prednisolone treatment for the ferret. The ferret eventually developed inappetence and then eventually became very weak and almost non-responsive to the point of a coma. They treated the ferret with dextrose, dexamethasone, and then went ahead with a pancreatectomy and nodulectomy. The day before surgery, they were giving glucagon at a constant rate infusion, or a CRI, of 15 nanograms per kilogram per minute, or 6.8 nanograms per pound per minute, which increased blood glucose and resolved the hypoglycemia in preparation for surgery. The dosage for the ferret for glucagon was extrapolated from canine and feline doses. Prior to surgery, they withheld food for the ferret for about 6 hours. That's a surprise to me, because I would think that usually for insulinomas, because they're always running into hypoglycemic crises, you wouldn't fast them. But maybe because they started glucagon and found that the glucose was elevated, maybe they felt comfortable with the fasting. I'm not really sure on that one. They found a 1 centimeter mass on the left limb of the pancreas and 4 smaller pale firm nodules on the body and right limb of the pancreas. The nodules, the lymph node, and the left pancreatic limb with its associated mass were submitted for biopsy, and that confirmed insulinoma, beta cell secretory tumor, which is what insulinoma is. I would have done a liver biopsy as well. The liver is a common site of metastasis with animals that have cancer, and so I think that a liver biopsy should have been collected at that time. The lymph node biopsy results came back as reactive. Immediately after surgery, the ferret's blood glucose was too high to be measured on that same glucometer. They gave 1 dose of regular human insulin, and then on subsequent rechecks, the blood glucose was high, so they started long-term insulin using porcine lente insulin. The ferret did well for about 2 months. Insulin was discontinued, but then abdominal ultrasound was repeated by about the 3-month mark, and there was another large nodule. They went to surgery again for nodulectomy, and the patient was euthanized. So, discussion. Insulinoma, also known as a pancreatic beta cell adenocarcinoma, is one of the more common neoplasms in ferrets. 1/4 of ferrets with cancer have insulinoma as the underlying disease. This prevalence is followed closely by that of adrenal gland neoplasia. Insulinoma most commonly develops in ferrets over 3 years of age, but has been described in ferrets as young as 2 weeks old. That's insane. It's insane that some animal types are so cancer resistant, like horses, for example, and then some are so prone, like ferrets. It's crazy. Very crazy. Diagnosis and clinical signs is often made through a demonstration of Whipple's triad, which is a combination of low circulating blood glucose concentration, clinical signs consistent with hypoglycemia, and improvement in clinical signs when given blood glucose or when glucose concentrations increase. Ideally, serum insulin concentration would also be measured to confirm the diagnosis. A result consistent with insulinoma would indicate a high insulin concentration but a low blood glucose. The rate of metastasis to other organs is quite low. Lymph nodes, liver, and spleen are common sites. Clinical signs also include stargazing, speed bumping, which is resting after a bout of activity, hind limb weakness, retching, pawing to mouth, seizures, coma, and death. Among ferrets with partial pancreatectomy and nodulectomy, it's reported to be associated with an increased survival time, Medical management consists of prednisolone with or without adjunctive diazoxide, which is a non-diuretic benzothiazide. Diet changes, where you offer small, frequent meals of high protein, low carbs to minimize insulin spikes. You can also give somatostatin analogs, so a deep-potent injection of octreotide acetate or doxorubicin chemotherapy. There is also some emerging interest in the use of kinase inhibitors like tocorinib phosphate that have been shown efficacy against neoplastic disease processes in dogs. In humans, kinase inhibitors like sunitinib, maleatate, and everolimus are efficacious against pancreatic neuroendocrine tumors. Chemotherapy used in the past includes streptozotocin, alloxan, and doxorubicin, and although reported adverse effects are severe, there is some evidence that survival times may be increased. Diazoxide is a costly medication with varied reports of efficacy, and adverse effects include the potential to further decrease blood glucose, as well as anorexia and vomiting. Some ferrets remain hypoglycemic, with a few becoming transiently hyperglycemic. Many will have redeveloped clinical signs owing to tumor recurrence, especially through the pancreas from other affected islet cells. Diabetes mellitus was transient in this case here. Results of a retrospective study indicated that the proportion of ferrets that remain hypoglycemic after surgery is over 50%. Reported disease-free intervals range from 0 to 23.5 months. In the ferret he reported here, there was a 3 months time period. Finally, glucagon is a hormone produced by the alpha cells in the pancreas that acts to increase the amount of glucose in the blood by promoting gluconeogenesis and glycogenolysis. It also regulates the rate of glucose production through lipolysis and stimulates the release of free fatty acids from triglycerides. There are no published reports of glucagon use in ferrets until this report here. Glucagon is used most extensively in human medicine as a short-term treatment for severe hypoglycemia in an emergency situation. So a couple of problems here. I know it's just a case study, but they didn't mention why chemo wasn't offered to the client, or maybe the client declined it. They didn't say any of that. They didn't go into comparisons with dogs, which, may not have insulinomas as commonly as ferrets, but also are a constant cause of confusion amongst veterinarians with diagnosing insulinomas and what to do. There are many cases that were either undiagnosed or mismanaged and all that stuff with canine insulinomas. I wish they went into more details on that. You can check out my YouTube channel if I have a pancreas talk. I've given plenty of pancreatic cancer talks in the past, especially focusing on insulinoma, but I'm not sure if I've ever recorded those, so it'd be a very old talk if it's on my channel. And we're going to go through one more article here from this journal in JAVMA and then go to the next journal. Thanks for supporting the channel. Take care.